Hello and welcome to today's edition of Diplomatic Passport, your daily weekday COVID-19 show that keeps you up to date with Zimbabwe's COVID-19 effort, as well as regional and global trends. My name is Blessing Munatsi. This show is, of course, made possible by ZTN's partnership with the Ministry of Information, Publicity and Broadcasting Services. Now we start by taking a look at the latest figures released by the Ministry of Health and Childcare. 79 new cases of COVID-19 were recorded yesterday from 4,019 tests that were conducted, representing a 1.9% positivity rate and taking the number of active cases to 1,753. 6 deaths were recorded, bringing the cumulative fatalities to 4,643, and the cumulative number of COVID cases now stands at 131,875. Zimbabwe currently has 60 hospitalized cases of COVID, and of these 5 are new admissions. 7 asymptomatic, while 34 of those are having mild to moderate cases, and 16 of those admitted to have severe symptoms, while 3 are in the intensive care unit. Moving on to Zimbabwe's vaccination program, 5,046 people received their first dose yesterday, bringing the cumulative for the first dose to 3,176,744, while 8,238 received their second dose to bring the cumulative for the second dose to 2,417,442. So more than 13,000 jabs administered yesterday. Now, people with a weaker immune system should receive an additional shot of approved COVID-19 vaccines, as according to advisory group of the World Health Organization, that's the SAGE, and the recommendations follow a 4-day meeting of the Strategic Advisory Group of Experts, that's SAGE, on immunization. A final report is expected to be issued in December. Now, SAGE said moderately and severely immunocompromised persons should be offered an additional dose of all WHO-approved vaccines, since these individuals are less likely to respond adequately to vaccination following a standard primary vaccine series and are at higher risk of severe COVID-19 disease. Now, people aged 60 and also older who receive the Sinovac and the Sinopharm vaccines should get the third dose too. This is according to the experts' recommendations, though the use of other vaccines may also be considered depending on supply as well as access. And now, when implementing this recommendation, of course, countries should initially aim at maximizing 2-dose coverage, like Zimbabwe is doing. 2.4 million vaccinated, already fully vaccinated in their populations, and thereafter administer the third dose after completing the full vaccination. SAGE has also reviewed a vaccine developed by Indian company Bharat Biotech, and will issue a policy recommendation after WHO greenlights it for emergency use. Now, this is what the World Health Organization WHO Director for Immunization and Vaccines, that's Dr. Catherine O'Brien, had to say about booster shots.
What we're really talking about right now is there a need to get a third dose of a vaccine if you've already received your first 2 doses? And there are really 3 reasons why we might want to give an additional dose. The first is if you didn't respond, if you're in a category of people that didn't respond adequately to the first 2 doses that you received. We do have some information that for immunocompromised people, it may be necessary to receive a third dose because those first 2 aren't doing what they do in otherwise normal healthy people. The second reason why we might give a third dose is if over time the immunity that you received and achieved as a result of being vaccinated starts to wane, it starts to deteriorate or go down over time. And in fact, the evidence right now shows that the vaccines are holding up extremely well to protect you against severe disease, hospitalization, or even death. So we don't see strong evidence leading to a need to provide a third dose for people who have already been vaccinated. The third reason we might want to give a third dose is if the performance of the vaccines are less or inadequate against some of the variants of concern that have emerged. And again, the vaccines that we have right now against the variants, and we're watching this very carefully, are holding up extremely well against the severe end of the disease.
So what exactly is the Zimbabwean perspective? Zimbabwe's chief coordinator of the COVID-19 response, Dr. Agnes Mahomva, said that the World Health Organization remains the guiding principle, although Zimbabwe will make its decisions after evaluating the situation on the ground.
We are definitely guided by WHO in a lot of things, their guidelines, you name it, but as you, I hope, are aware that when they do issue any guidelines, SOPs, and so on, we take them and look at the situation on the ground and adapt. So it doesn't mean every single thing that is recommended by WHO it's automatically taken on board. We have to look at what's on the ground. So this is breaking news from WHO. We are looking at it, at the same time looking at our situation on the ground. Remember, our policy direction is about getting the largest percentage of those who are eligible for vaccination to be vaccinated before we start looking at and you call them booster. But I think WHO carefully announced that they're not providing any boosters. They're really additional shots for those who are immunocompromised and so on, because it is the same WHO that continues to recommend that nations have got to first prioritize and make sure that a largest percentage of their population has been vaccinated using the standard doses, i.e. 2 doses for the Sinopharms or 1 dose for the J&J. These additional doses are for indeed immunocompromised, so we will look at it and decide for our nation.
As Dr. Agnes Mahomva there, true to Zimbabwe's approach of a scientific, fact-based decision-making, and of course advising there that the country will come up with tailor-made solutions in accordance, of course, with the WHO guidelines. Well, another development was happening in Burundi, had initially excluded themselves from the African countries set to receive the COVID-19 vaccine under the COVAX facility at the beginning of the year. It wasn't actually Burundi. Tanzania had also excluded themselves there. Media reports say on Friday, after the World Health Organization announced plans for the vaccine rollout, the health minister of Burundi, Tadi Ndikumana, said that at the time the country was more concerned with the prevention measures, according to local media that had been stating that 95% of more of the patients were recovering, and estimated that the vaccines were not necessary. This was the position at the beginning of the year. But Burundi's government now says it will accept COVID-19 vaccines, becoming one of the last countries in the world to embrace them. But the health ministry says it will not take responsibility for any side effects that may be suffered. And Health Minister Tadi Ndikumana on Wednesday said the vaccine will arrive with the support of the World Bank, and it was not immediately clear how many doses the East African country had procured or will receive, and the vaccine will be given to those that need it, according to the health minister. Now, Dr. John Nkengasong, the director of the Africa Centers for Disease Control, that's the Africa CDC Prevention in Africa, said that they facilitated the delivery of vaccines in Burundi and were assessing the progress of the program.
A few weeks ago, Burundi has officially engaged with COVAX and AVAT to get vaccines. I think that is very good news. And I'm not aware that they have received a shipment of vaccines. I think that is very, very, very encouraging. And if they have, we stand by to work with them. As a matter of fact, there's we have actually received a request from the country, from the Ministry of Health, to support them in their vaccination efforts. So we will do everything possible to not leave any country behind. And as we know more with the vaccines, in terms of what kind of vaccines and what quantities in Burundi, we will, of course,
So it is encouraging to note that all African nations have embarked on the vaccination. Burundi and Tanzania were being the last to take on the program. But Zimbabwe, of course, has made significant progress, being one of the 8 countries that managed to beat the 10% population vaccination by the end of September. And it seems to be making progress. However, we will see if we can meet herd immunity target by year end. Well, this brings the diplomatic passport for today to a close. My name is Blessing Munansi. Thank you so much for making us your choice. We're back again, same time, same place, same channel. Do make a date with us tomorrow on this program that has been made possible by ZTN's partnership with the Ministry of Information, Publicity and Broadcasting Services. Until we meet again tomorrow, it's bye-bye for now.